Police checkpoints, face masks at every corner and non-essential shops locked up. The city of Firokeh in southern India and its 50,000 residents are slowly emerging from a total lockdown. Late August, authorities detected a new Nipah outbreak, a rare and deadly virus with a mortality rate up to 75%. This year, 6 people were infected, 2 of them died. Alavi Kuti owns a furniture shop. He hasn't been able to open for a week.
We did not open the shop as the government ordered a lockdown. We had to comply. I am happy to reopen because the lockdown was a real financial strain on us. We were unable to earn our daily wage.
This is the third Nipah outbreak in Kerala in just 5 years. During the first epidemic in 2018, 17 out of the 18 people infected in the region died. Kerala's communist government is determined to never repeat this tragedy and is now taking drastic measures: massive testing, contact tracing and strict lockdown. First applauded for recording one of the lowest death rates in the initial stages of the COVID-19 pandemic, Kerala quickly became a model for fighting epidemics. The first case was detected in this rural village of Kozhikode. Sajid Kazakil is the head of the village council. As soon as the virus was spotted, Sajid and his team set up an emergency crisis unit.
We set up a rapid response team. We appointed 2 volunteers for every 50 houses in the containment zone. They took part in the field work and they went to every house and recorded everyone's temperatures. They covered 3,375 houses in just 5 days and identified contact cases. I think that's quite an achievement.
Just like COVID-19, Nipah is a zoonic virus that spreads from animals to humans.
Look, this is where the bats sleep.
Natural carriers of the virus, the authorities blame the return of the epidemic on these flying mammals.
A month before the outbreak, a government team contacted us to run tests on the bats. Our local council did everything they could to help. We still don't know how it's spread, but the research is ongoing.
Experts argue that bats contaminate the exotic fruit growing abundantly in Kerala's tropical climate through their saliva and urine. So farmers find themselves at the forefront of the epidemic. Mate Varghese is one of them. His family has been growing rambutan for over 5 decades, a fruit similar to lychee, sweet and juicy, that bats regularly devour.
It's because of that only.
These nets prevent birds and bats from eating the fruit.
Breaking the chain of contamination at the very first link, whatever the cost.
We usually get 3,000 to 4,500 euros for this plot per season. But because of the current situation, we can't even sell the fruit that's been protected by the nets and hasn't been pecked by birds. We have to be cautious because we can't be certain that bats did not eat it. So we can't sell a single fruit in the market.
To this day, there's no vaccine or treatment for Nipah, but extensive research is underway. For the last 5 years, health authorities have been working with villages to study its transmission. In this hospital, a microbiology lab is dedicated to studying infectious diseases. Some of the best epidemiologists of the country are based here. Dr. Anup Kumar is the head of the intensive care unit at the hospital. He discovered the virus during the first outbreak in 2018. For him, every new epidemic is an opportunity to better prepare for the next one.
So we are planning so many researches along with that. One thing, obviously, the seroprevalence study to specifically look at what is the type of immunity the people are developing, how long that immunity is going to protect. And obviously, we had a previous COVID outbreak, COVID vaccination, all those things, whether that is having a cross-protectivity to these Nipah infection.
Anticipation and preparation, key elements of the Kerala model. Such a unique one that it's even been a source of inspiration for the big screen. Roughly 100 kilometers away, in the coastal city of Kochi, these 2 friends wrote one of Kerala's highest ever grossing movies. Titled Virus, the scenario is based on the 2018 Nipah outbreak, a tribute to the medical staff, aired just a few months before the COVID-19 outbreak.
Us citizens are proud of the way Kerala handled the Nipah outbreak. The state, health department and medical community all worked together to contain the virus. The story of how they all worked together during the crisis needed to be told. And I think it also helped raise awareness.
A success story that can also be attributed to Kerala's medical staff to population ratio. 4 doctors for every 1,000 people. That's the highest in the country and double the national average.